Come on, you ready? Hey.
Stop touching me.
Oh, it's therapeutic.
Hands off. Hello and welcome back to Physio Matters TV. It's episode 2 and we've come to Exmouth today. It's the home of Anna Maria Mazzieri and the School of Soft Tissue Therapies. So I wanted to come to the school and talk to Anna about basically the future of massage therapies and where it fits into musculoskeletal healthcare. Anna is a great friend of the podcast. You'll have listened to her co-host the Massage Matters podcast, which goes out across our podcast feeds. With the debates on social media about moving away from specific soft tissue-centric models of care, I'm really interested to know where the soft tissue educators feel that massage fits into these modern MSK paradigms. And to find out how massage therapy education is going to evolve over time to keep up with the rest of MSK healthcare. Hello Anna, welcome to Physio Matters TV. We're on our second episode and we decided to come visit you. First thing I kind of want to explore is you personally, because I think it's going to be really relevant to some of the conversations we'll have later about where massage is going to go and soft tissue therapies are going to go and how they fit into MSK healthcare.
As you can hear, I'm not British. The accent might have given it away a little bit. I come from Italy. There was a local course in massage therapy, and because where I come from, massage is such part of our life. Is something that we access quite freely, and so I thought, let me join this course. And I kid you not, I just loved it. Something just made sense to me. I never worked isolated. Already taught me about the multidisciplinary approach of healthcare. I wanted a place where people approached health and well-being and treatment of pain and injury that included a hands-on approach. Starting teaching, I just realized how very stuck this industry was, especially I found certain qualifications where, I kid you not, a tick box, and I couldn't cope with that. And I approached then the ISRM, which is the professional body I'm related with, and I then started teaching that qualification.
Hi Becky.
Hi, how are you?
Yeah, very well, thank you.
I, years and years and years ago, kind of fell into a job in the ambulance service, working in ambulance control. At the time, I was doing a lot of triathlon myself, and to be honest with you, had this sort of whimsical idea that sitting in a field on a Saturday afternoon giving people sports massage wasn't a bad way of earning a living. So I'm now back working at the clinic with Anna Maria as a therapist, and also at the school as well, both as a tutor and helping Anna just run it really.
You guys integrate evidence-based medicine or evidence-based practice into your educational components, which is something that we hadn't come across as being widespread within, let's use massage for the minute. I know we can talk about the difference between massage and soft tissue therapies. Is that something that you guys found easy to transition to, or was that a real challenge to move into with regards to building an educational program?
What a lovely, lovely question. So originally for me, I come from a very structuralist, biomechanical background. I knew that things were not kind of making sense, and what I was seeing in clinical practice could not be totally explained with what fully the biomechanics or what the very structuralist and reductionist approach. Because I come from a massage therapy background, evidence-informed or evidence-based practice was not even discussed. So we are service providers. We are under leisure. So evidence-based practice was not even part of our vocabulary. I have to give heads up to Adam Meekins, because I remember was one of the first, long time ago, that started me into this journey. And all of a sudden, to me, it just, oh God, it helped me to make sense of those things that I couldn't explain. Because sometimes I remember I used to say to clients, oh, you get better when you come here because of my accent. You know, oh yeah, because you like the room, because you like the music I play, because, you know, we chat. And all of a sudden, things started making a little bit more sense. So to me, there was not as much of a challenge or a cognitive dissonance that it might have been for many of my colleagues. But also because I think I'm quite open to change and never marry with an idea. So for me, not having to say, actually, yes, it's great what the fascia research says, is not relevant for critical practice. Everything that I learned so far, actually, it's been built on a beautiful story, but that's what it is. It was fine for me to say that because I still practice the hands-on type of touch that they taught me because it's very valuable, but why is valuable, that is dramatically changed.
How have you found that transition into that way of working using evidence-informed practice?
Not easy, and it's something I have to work hard at, and it's something that it certainly doesn't come naturally to me. I like that side of me from a teaching point of view because I've got that empathy with people that turn around, especially massage therapists that are trying to make that transition into being a bit more evidence. They want to make that transition, but they don't know where to start. They don't know how to read papers, journals, etc. I suppose I've come at it maybe back to front. I'm with clients. I want to understand how to help them. I want to understand how to answer their questions. I see a purpose now to pushing myself to learn that. There have been people that have helped me make that transition. And that's what I like to say to our students a lot is, you don't need to start by going and reading journal articles or reading an entire RCT. You need to find people who you can trust that can help you translate that information.
For the industry, yes, it's been hard. It's been very, very hard because when you have to deal with people that either rightly so or right or wrongly, I'm not here to judge, but lots of people identify themselves with their profession and actually identify themselves with the outcomes that they get. And because of the people identifying them, all of a sudden you say, actually, what you've been doing might not be at the best interest of the client, or what you've been doing actually, again, it was built on a story which is not necessarily biologically plausible. I am very, very lucky, and that's also the reason why I chose to remain with ISRM, because I could see that there is a potential there. Not everything is not, easy, but definitely there has been they allowed an opening for us.
There's obviously this very blurred line with soft tissue therapists, massage therapists, helping people with musculoskeletal conditions. So talk to me a little bit about the differences, in your opinion, between massage therapy, soft tissue therapy, and where along that spectrum do you move from a service industry into healthcare?
As you know, with the history of your profession, massage was a big part of your profession. And then, rightly so, you guys evolved, your profession evolved and removed more and more massage as part of treatment. But some people, they do want, they seek that pain treatment or that injury treatment, they still seek that hands-on, like manual therapy or massage therapies even more. So the need was always there. And I think what's happened though, that to become respected out of the relaxation, out of the spa, out of the sometimes in this country very sexualized implications that massage had, we had to become so clinical and so structuralist. That's why I call this sports massage or remedial massage. The massage is only one modality. It's only one interaction. It's only one part of the interaction. In fact, I always say it's actually the context where the real interaction or encounters takes place. So in order for us to be seen as a profession and not as a modality, we have moved and called ourselves soft tissue therapists. Person-centered approach to the assessment, treatment and rehabilitation of minor and chronic injury and pain. So that, yes, we use massage, but it's only one part of it. We don't want to be defined by the modality we use.
So Anna, what makes the school's curriculum and your education, what makes it different to other types of massage and soft tissue therapy education?
Because our school doesn't teach massage as a modality. We teach it as a context for the encounter, for the therapeutic encounter, which is made of assessment, communication, advice, and because our foundation of our course is solidly based on a person-centered care.
I think as soon as you start talking in those terms, where you're starting to do movement assessments, you're starting to sound a lot more like a physiotherapist. Yes. Or where physiotherapy likes to think it is. It's going to sound really brutal. At what point do you feel like you're providing a service that should be done by a physiotherapist?
We really try to install in our therapists that there is a massive difference between the two, training, scope of practice. We are training people to be very proud of the scope of practice.
Not everybody wants to be a physiotherapist. I did not want to be a physiotherapist. I wanted to work with the kind of people that I see. They're not people that are well served in the NHS. I think there's this fear in some manual therapists that once we accept what we can and can't do, that we lose our value a little bit. The way I've seen it is that actually I think that increases my value, because I can be really comfortable as to where I sit, what I'm good at, what my limitations are, and that makes me a very good soft tissue therapist.
Well, we're really, really strong with our students and in our industry is to show that we do have value in healthcare without wanting to be physiotherapists, without wanting to be osteopath or chiropractors. So we have a scope of practice that can fulfill the needs of a lot of clients out there.
I don't necessarily think physiotherapy is the right place for manual therapy, because physiotherapy, in my opinion, rightly has gone down this very evidence-based approach, and there are more evidence-based things that you could be doing with a physiotherapist. However, if you choose as a client, but I also want some manual therapy, then I think that, to me, is where the soft tissue therapist sits really comfortably.
I feel like you are not representative of the industry.
Yeah.
Where do you feel like the industry is at the moment with regards to screening, treating appropriately, referring on? Do you think they're getting there, or do you think you're still lagging behind?
So we're definitely sitting in silos. I'm very lucky to see a really positive part of the industry that is making leaps forward. It's a very small part. Where you were a few years ago yourself, so you have a majority now that are really forward thinkers and evidence-based, and we are different because our training is different. So we have to battle with people that evidence-based is not for them part of the vocabulary. While we have to compromise on certain things, the message to me is uncompromising. You cannot be working with people in pain or injury without the safety of what evidence-informed practice will give you. So for me, if you say yes to the person that comes to you with a shoulder pain and they say, oh yes, yeah, come in and I can help support you with that, then you have to be prepared to put the work in. And if not, we can remain in the leisure industry, which is absolutely fine. There is nothing wrong, but then we're not going to be treating.
Have you experienced many people who are coming on the course and then they're going, oh my goodness, we're doing this evidence-informed practice. Yeah. You're telling me that I'm not melting fascia and breaking down adhesions and being all superstructural, and actually communication is a bit more important. How much pushback do you feel like you're getting? And I suppose the second part to that is, I'm guessing your course is self-select.
Yeah.
So do you think you put off people who go elsewhere to get what they want?
So the first part is it's getting less, which I think for me is really interesting, because I think that's a general change in society. And I think when the first day of our course, we start talking about pain science, we start talking about the BPS model. And I've noticed really in the last year, students are far more accepting of that. There are still people that come on the course who have certain backgrounds or have had certain experiences. You do get some kickback, of course you do. And it is hard when you kind of have this idea of all these wonderful things that you can do with your hands, and then someone says, well, actually, can we challenge that a little bit? I do think our course is self-selecting to an extent. People that join our course have already made that decision to invest a little bit more time and a little bit more effort into that, and I think they're probably more questioning people anyway, potentially.
You know, it doesn't mean that you have to be a physio, or you have to be a wannabe physio, like people do. You see them doing courses, and I'm so sorry if this is going to upset some people, but hey, they're going to do a 2-day course on manipulation. It just irritates me. We don't need to do that. Not only because of the lack of specificity and what we know about manual therapy and touch, but because actually you've got amazing skills, which is touch. Improve your communication skills, improve the way you interact with a client. You don't need to do any manual therapy. You don't need to be a wannabe osteopath chiropractor. So people want to have the same scope of practice of physiotherapy, chiropractor and osteopath, but they don't want to put the hard work, which is evidence-based.
Becky, what do you think students, currently ex-students, what do you think they would say about the school's curriculum?
That's a really interesting question. The feedback that we get is that it goes much deeper and much further than they expected it to. Sometimes that's a challenge for students, but generally I think they come out the other side and are glad they've gone through that challenge, and actually once they then go into practice, they realise that that has stood them in much better stead than had they have not.
I graduated last year with a degree in physiotherapy from the University of Plymouth. Previously to that, I was originally a teacher, and during that time I studied at the clinic for soft tissue therapy. So I'm currently almost a year into working for the NHS.
And how much did you find your training in soft tissue therapies helped you then in your physiotherapy degree?
Massively. It really has. With my communication of patients, being able to build a rapport, being ahead of the curve with certain things such as the biopsychosocial side of it, pain science and all those kinds of things. I felt that I'd already come with quite a good baseline for that.
You know, there are times where you're stood at the front of the class teaching and you can see some faces drop and you think, oh, I might have to kind of safety net them all here a little bit. But I think more and more it's making sense to people.
For me, you know, the transition wasn't a problem as such because of my science background, but actually what it did was it gave another level of kind of assuredness to what you were practicing and why. So again, it helped us to challenge the idea of bias, because obviously we all have biases about certain things, but at least if you're underpinning and you're using evidence to inform what you're doing, you're still maintaining the client as your kind of paramount interest, not your own biases.
And one of the things I think is interesting about your journey is it's quite reflective of a lot of massage therapists. What is it that meant you decided to go for that?
A huge part of it was practicality. I needed to be able to work and qualify, and there had to be a weighing up there of what can I do and still pay the bills. But also I think more than that, for me, I learn in a very practical way. I learn by being able to apply things very quickly. So it's no good me having a lecture and then 6 months later going off and doing a placement that might be relevant. I need to kind of put that into practice straight away. And that type of learning suits me. And I guess that's why I get on my soapbox a little bit sometimes about that not being any lesser of a learning experience. It's just a different learning experience that's always going to suit different people. And we want that variety of people in the profession. So there's got to be ways in for people, however they are able to learn.
I picked the school because it allowed me to still work during the week and yet train at weekends in the evenings in my own time. I couldn't stop and do a full-time course at university. That, you know, I've got 2 children and a mortgage, so that just wasn't going to happen.
Social media is a funny place and everything gets polarised.
Really? We didn't notice.
I don't want to drop bombshells on you. There is a caricature of a debate which would be hands-on versus hands-off, which no one here is sitting here going, that's a sensible debate to have. But there are corners of healthcare that would say soft tissue therapies, hands-on therapies are of low value and other things should be offered. What would you say in response to that?
Sorry, low value in relation to what?
Being undervalued, very much so, especially as we progress further in the physiotherapy degree. But for my clients and patients, never.
Massage and manual therapy are low value if you're looking at them to cure a problem. That's where they're low value. If you think you're going to fix somebody through massage or manual therapy, that's where they're low value. In a wider context of helping somebody, I think they have a value.
I'm quite happy that it's not provided through NHS, because the very limited resources NHS has, we might want different interventions, okay? But when we're looking at private practice and we're looking at the client needs, I do think that manual therapy has a space there.
I believe that in the moment that the client is paying to access a service, when it's privately funded, I do think that the client then has that degree of control to say, this is the type of professional I want to go and see. There are lots of people that don't always feel comfortable going through a normal healthcare route, if you like. If that means they come and see me rather than nobody, I'd prefer that, because I feel they're more safety netted.
Are we giving too much importance to the manual therapy physiological effects?
A lot of people would say manual therapies are of low value comparative to exercise, for example.
Yes, it is a short-term effect, but we do know that for people that respond well, early symptom modification within the treatment, that is quite prognostic for a better outcome in the future.
This shouldn't be an either-or debate. I dislike the idea that as soon as you come to see a therapist who identifies as being predominantly manual therapy based or massage based, that you're suddenly taking exercise off the table. I don't know any therapist that's suggesting that at all. And I'm sure any soft tissue therapist, massage therapist listening to this, one of the things they'll tell you is that you see a client every day who says, oh, I went to see the physio, they were useless, they didn't touch me. Now I know that's not the physio being useless, I know that's the physio doing precisely what they should be doing. But because for that particular client, they needed that way in, and I'm not saying that we just use massage as a buy-in, I'm saying that these individuals respond to a different approach. Yes, that exercise-based approach might be the gold standard, but it's only the gold standard if someone's going to access it and is going to engage with it. If you only give that care to those people who are going to engage, you're just forgetting a huge swathe of the population.
Why we keep talking about manual therapy as the intervention? It is the context in which the real intervention, which is communication, which is reassurance, which is helping the client making sense of the pain, which is advice, it's then delivered.
Where do you see the educational component going?
First and foremost is to understand your boundaries, to be a good clinician in terms of recognising your red flags, learning your referral pathways and things like that. I still think there's a skill in touch, and I still think that there are skills to be learned around that. That's not about being specific, but that's around learning different ways of using massage and touch for different people. And then I think we need far more emphasis in our courses around what are traditionally termed soft skills, which are not soft skills at all. You know, therapists need to learn how to have conversations with people, how to conduct a good subjective assessment, how to be comfortable in giving people lifestyle advice, how to be comfortable in explaining to clients about pain and helping them explore their pain experiences a little bit more. Those are all things that still need to be taught. But that's, for me, that's where I think the education needs to go.
My final question really, I suppose, to you as an individual on a journey through massage therapy and soft tissue therapies is with regards to informed consent. 1 in a billion are going to come in, lie on your couch with an obvious ankle sprain injury, but it will turn out to be cancer. And for me, I've got to fall back a little bit on that. I don't know if massage therapists do.
it's the same for you, isn't it? Ultimately, you got to be a bloody good clinician, and this is what we're trying to do. We're trying to make sure that we are good clinicians.
Anna, what is the future of soft tissue therapy, both for soft tissue therapists, but also for the other professions, physios, osteos, chiros?
I don't know what the future is. I tell you what, I would love the future to be, and I'm very positive about it. I do see it as those barriers being broken down. We are all becoming MSK practitioners, each of us with our biases. But ultimately, the fundamental basic skill set and learning outcomes, talking as an educator, will be the same for all professions. The only specificity that exists is the person in front of us. Their needs and who they are is specific, not our skill set.
So we've been filming for most of the afternoon with Anna and Becky and the school. I think it's very easy to be swayed by the two of them towards their biases. They've talked about biases plenty, their bias for touching patients, but they make very convincing arguments. I think that this caricature of an argument of hands-on versus hands-off is obviously crazy, but it's about how do we find a place for touch and a place for manual therapies within the musculoskeletal healthcare sphere. It's really interesting, especially to listen to Anna talk about how they're teaching massage and soft tissue therapy and manual therapies, not as an intervention, but as a conduit to further conversations. I think there are still issues with it in that, as we've discussed, their ability to differentially diagnose is limited. It makes me feel uneasy at times to think about patients not having access to someone who is medically trained for those admittedly rare occasions where they do have something unusual or sinister causing their symptoms, even though it might look reasonably simple. In my opinion, they're best placed as technicians, where they're referred to and provide a, for want of a better term, a service. But as Becky alluded to, a lot of people don't want to go directly to a conventional route of healthcare. It's also really interesting to think about how the more qualified clinicians can learn from the soft tissue therapists who are looking to reframe the treatments that they're providing. Can physiotherapists, for example, learn about how they're providing exercise therapies and exercise interventions and provide them in similar contexts? Is there something we can learn there to make things more effective? Is it a conduit to opening conversations? It's also really interesting to think about the value of care being provided by each type of therapist. So is it worth physiotherapists, for example, continuing to provide manual therapies when there are very skilled manual therapists providing those types of therapies? And hopefully you've seen in some of the videos, Anna was trying to teach me how to do manual therapies or massage, and to be honest, I am awful. It's certainly not within my skill set. There might not be a skill in specifics for manual therapy. There is definitely a skill in application and touching appropriately patients in a therapeutic way, and I do not have that skill set in any way, shape or form. So I suppose the questions that remain for me are, is this an example of very progressive soft tissue therapy that is not reflective of the rest of the profession? And if so, what do we all do in MSK therapy to bring everybody else up towards what the school are teaching? Questions I want to ask of physiotherapists, osteopaths, chiropractors is, do you think that manual therapy still plays a very big role, and how are you utilizing that therapy within your treatment sessions to make sure you're getting the most out of it without overselling the effects and using it as a conduit to having better conversations, helping people be healthier? And I suppose, is the rest of the massage and soft tissue therapy industry keeping up with the school of soft tissue therapies, or are these guys just a flash in the pan, unique set of pariahs who actually are going to create their own type of therapist, which is separate to everybody else? Having spoken to Anna and Becky today, there is a place for this kind of therapy. Where that sits exactly within the wide scope of MSK model type treatments is probably quite different depending on what setting people are in, and also what the individual wants, as they alluded to really nicely. It's some people are seeking out that type of touch. Other people seek out exercise-based therapies, and if we completely removed touch and manual therapy, for example, if the hands-off debate won, for example, then we're really going to alienate a whole set of patients. So a lot of questions still remain for me, but really enjoyed talking to Anna and Becky today. Really think that they're pushing their profession forwards, trying to evolve within an evidence-based model. I'm really impressed by what they're doing.